My name is Dr. RUBEN Echemendia. I am a clinical neuropsychologist who has been specializing in the area of sports-related concussion for the better part of 30 years at this point in time. My practice involves a broad range of individuals. I've worked with children as well as middle school, adolescents, adolescents in high school, colleges, and the pro sports. Let me just start by saying that most people have never heard of a clinical neuropsychologist or know what a clinical neuropsychologist does. And the best way to explain what a neuropsychologist does is to actually look at the name, and that is neuropsychologist. So we are doctoral level individuals who are trained specifically in the evaluation of brain functions, and that's the neuro part, as well as the evaluation and treatment of psychological components. And within concussion, we see both aspects come through quite frequently. Individuals who are having neurological or cognitive thinking kinds of issues, as well as psychological issues related to perhaps anxiety, depression, frustration, anger, and a number of other concerns. So neuropsychologists are specialists in really working with both ends of the spectrum that end up manifesting themselves in concussion. We often get asked the question of how do you know when to go to a neuropsychologist, or even how do you access a neuropsychologist? It's important to recognize that neuropsychologists have been at the forefront of clinical evaluation, management, treatment, and research of concussions for a very long time at this point. And we've really developed expertise in this area. So when someone asks me, when should I go see a neuropsychologist? I often let them know that concussion is a complicated injury. And if you want to learn about what's happening with you, if you want to better understand what's happening with you, then the sooner you go see a neuropsychologist, the better. You may not even need any neuropsychological testing at that point in time. All you may need is an initial interview to be able to understand what may happen to you, get you familiar with the injury, and what are the common manifestations of the injury. For those who move further down the road and end up having complications of the injury, they have issues with return to play, they have issues with whether they should return to play, whether they're having difficulties in school, whether they're having difficulties in a variety of different areas, then it's important to meet with a neuropsychologist who could help sort out what symptoms are being created by what factor. The important aspect of this injury is that the symptoms of concussion are not specific to concussion. So the symptoms that we see with concussion can come from a variety of different places, ranging from not having enough food in your stomach in the morning and having your blood sugar drop, to being dehydrated, all the way up to being anxious, or to being depressed, or being frustrated, or having difficulty with your memory, difficulty with your thinking abilities, feeling like you're a bit slow. All of those things are assessed by, evaluated by, and then treated by a neuropsychologist who works as a part of a broad-based treatment team. Very often when people hear the word psychologist, they think back to Freud and being in therapy for 5 years at 2 or 3 times a week, and that's not what we're talking about here. What we're talking about here is short-term, limited, targeted treatment to help the individual identify their symptoms, identify where those symptoms are coming from, and then developing a plan for attacking those symptoms. If you were to ask me, what can I expect when I go see a neuropsychologist following a concussion? And the answer to that is it really depends on what the symptoms are, what your concerns are, and what you're looking for at that point in time. At the most basic level, you can expect a neuropsychological evaluation that may take anywhere from 45 minutes to an hour and a half, really to take a look at your thinking abilities, your cognitive functions, all of the things that tend to be affected by concussion, in addition to psychological factors. Other things that you could expect is really talking about your life and how you come to be the person you are sitting in front of the neuropsychologist at that point in time. Because nobody has a concussion in isolation, right? We all bring a history to that first meeting. So I want to understand a little bit about you. Is this your first concussion? Is this your sixth concussion? Have you had lots of buddies with concussions? Have you had lots of friends with concussions? What have been their experiences? And then I want to know everything I can find out about the concussions you've had, because I want to be able to create a profile of you in my head to help then sort out what the issues are that you may be having. And then once we sort those out, then we can identify targeted treatments to help those areas. For example, you may come to me and we find out that you're really worried, that you're really anxious, and you tend to be a person who tends to be a worrier. So what are we going to do? We're going to figure out, okay, what are you worried about? Is it realistic? Is it not realistic? And if it is realistic, what can we do to help you better manage that worry? Because we all worry. This isn't just because of the concussion, it's to help you manage that worry. Just like you may come in and you may feel really frustrated because you can't play the game, you can't watch TV, you can't do all the things that you like to do because somebody has told you to put yourself in a cocoon and to not do anything else until all your symptoms go away, which is, by the way, the worst advice that you can ever get from somebody. So what we need to figure out is, what are the things that are bugging you? What are the things that you can do and do them more? And what are the things that are causing you difficulty? And then how do we figure out a way to gradually start adding things in so you get back to being the normal person that you were before you got hit in the head? Another important thing to keep in mind is that psychological symptoms frequently accompany concussion. Symptoms like anxiety, symptoms like depression, like frustration, like anger, irritability, all these things frequently accompany concussions. And really they take people by surprise because they're not used to having these symptoms and they don't know how to talk about the symptoms because they're perplexed by them. It's important to share those symptoms, because as soon as we can identify the anxiety, the depression, the frustration, the irritability, all of those things, as soon as we can identify them, we can do something about them because we have treatment approaches for all of them. One of the most important things I want you to take away from this is that concussions are treatable, that we can treat them, we can identify what the issues are, and we can help you get back to your normal functioning. You also need to keep in mind that by and large, most concussions resolve on their own within a relatively short period of time without any subsequent or later life issues. The sooner that we can identify what the issues are that you're having, the sooner we can intervene, the sooner you can go back to having a healthy and happy life, which is what we expect for all of you.